Welcome to the Friday edition of the MD Edge Daily News. I'm Nick Andrews.
And I'm Terry Rudd. Today, in vitro fertilization is linked to a slight increase in risk for some cancers.
Also today, depression screening rates remain low for undiagnosed adults.
And later, could hot days and air pollution trigger lupus flares?
But we begin today with a new analysis that estimates that adopting new hypertension guidelines would add 15 million Americans to the ranks of hypertensives. Under the 2017 guidelines from the American College of Cardiology and the American Heart Association, about half of those patients would be candidates for treatment. That's according to research that examined two large data sets from the US and China. The vast expansion would happen by resetting the definition of adult hypertension for the long-standing blood pressure threshold of 140/90 to the new guidelines definition of 130/80. Dr. Harlan Krumholtz is a junior professor at the Center for Outcomes Research and Evaluation at Yale School of Medicine. He says the guideline changes aren't firmly rooted in evidence, and they could have important health policy implications, including significant strain on public health programs. The analysis was based on the two most recent cycles of U.S. National Health and Nutrition Examination Survey, as well as the China Health and Retirement Longitudinal Study. Under the new guidelines, researchers report that more than 70 million Americans aged 45 to 65 years would be classified as hypertensive. That's a 27% increase over the 55 million hypertensive Americans per the less stringent JNC8 guidelines. In the Chinese population, more than 260 million people aged 45 to 65 years would be classified as hypertensive. That's a relative increase of 45% compared with the JNC8 guidelines. And Dr. Krumholtz and his colleagues also report that the number of Americans eligible for treatment would jump more than 8 million to about 16 million. The number of eligible Chinese would jump about 75 million to more than 129 million people.
A large observational study from Great Britain paints a mixed picture of cancer risks associated with assisted reproductive technologies such as in vitro fertilization. Among 250,000 women who had assisted reproduction over a 2-decade period, there was no significant increase in risk of uterine cancers or invasive breast cancers. However, those women were at a slight but significant increased risk for in situ breast cancers as well as invasive or borderline ovarian cancers. That's according to research by Dr. Alistair Sutcliffe and his colleagues, which was published in BMJ. Dr. Sutcliffe is a professor at University College London. He notes that the ovarian tumors in this research may be related more to patient factors than to the reproductive technology. The researchers included women who received assisted reproduction treatment between 1991 and 2010. The research had a total follow-up of more than 2.2 million person years. During an average of about 9 years of follow-up, there was no significant risk of tumors in the uterine corpus, and there was no significant increase in the risk of either breast cancer overall or invasive breast cancer. However, there was an increased risk of in situ breast cancer, with a statistically significant standard incidence ratio of 1.1. Furthermore, the women also experienced a significantly increased risk for ovarian cancer, with an incidence ratio of about 1.4. Increased risks of ovarian tumors were limited to women with endometriosis, low parity, or both. Women who had previously given birth and didn't have a diagnosis of endometriosis had no increased risk for ovarian cancer.
Depression among U.S. adults remains underdiagnosed. That's according to research by Dr. Sandeepan Bhattacharjee of the College of Pharmacy at the University of Arizona. Dr. Bhattacharjee and his colleagues report that depression screening rates in U.S. adults was 1.4% between 2005 and 2015. That's despite a U.S. Preventative Services Task Force recommendation back in 2009 for routine screening. The researchers reviewed data from the National Ambulatory Medical Care Survey and included adults aged 18 years and older who didn't have a previous history of depression. The report showed that year-to-year screening rates varied. 1 year before the 2009 recommendations, the screening rate was 0.65%, which was the lowest seen during the study. The highest rate seen was 3% during the final year of the study. In a multivariate analysis, there was a significantly increased likelihood of depression screening each year, and screening rates increased significantly after the task force's recommendations. There was also links between how much time a patient spent visiting a physician and higher screening rates. Dr. Bhattacharjee understands the immense difficulty in increasing the length of time that patients spend with physicians. He recommends that other healthcare providers in these settings be trained to provide screening.
Finally this week, both air temperature and air pollution levels affected the likelihood of experiencing a flare in lupus disease activity. That's according to a study presented at the European Congress of Rheumatology. The researchers found that for every 1 degree Fahrenheit increase in temperature, systemic lupus erythematosus patients faced increased odds of experiencing a skin flare, joint flare, or neurologic flare. Conversely, renal flares were less likely to occur with rising temperatures. Pollution also impacted outcomes. For every 1 microgram increase in particulate matter pollution, there was an increase in serositis and hematologic flares. Dr. George Stoyan is an assistant professor of medicine and the coordinator of the Lupus Center at Johns Hopkins University in Baltimore. He says 2 factors prompted the research. First, he was seeing flares in the clinic that didn't appear random. Second, patients made an interesting observation. Each year, patients at the Johns Hopkins Lupus Center meet and get a first-hand look at some of the research. And patients were reporting to each other that they felt as if they were experiencing similar flares. The researchers gathered data on about 1,200 patients with lupus living nearby. They then linked disease clusters to average temperature and pollution data. Dr. Stoyan says ties between flares and skin symptoms and the summer have been identified before, but finding a link between temperature and joint and neurologic flares is new. And that concludes this edition of the MD Edge Daily News. Links to these stories can be found in the podcast description. You can follow the Daily News on Twitter. We're at MD Edge Daily News. For everyone here at MD Edge, I'm Terry Rudd.
And I'm Nick Andrews. Thanks for listening to the MD Edge Daily News, and have a happy, safe weekend.